Hi, Dr. Gonzalez. Hope you're doing well. I don't have PowerPoint on my computer, so I uploaded a keynote to YouTube. I hope that works for you. Please let me know if I need to do something different. So the patient is Karen. She's a 17-year-old African American female from a low socioeconomic status living in Long Beach, California. For more than 2 years, Karen has been treated on and off by doctors and specialists for undiagnosed stomach pain. These pains have caused significant stress in her life. She has missed school, turned in assignments late due to hours spent on the internet trying to look for answers, and she has been warned that if she misses any more school days, she will not be able to graduate. Karen's family has spent thousands on specialists, all to no avail. Karen is overweight, anxious, and has few friends at school. She states that the pretty cheerleader girls at her school don't know what it's like to have pains like this. After more than 2 years with no diagnosis and all blood work coming up normal, Karen's doctor suggested to her parents that she may be better off seeing a therapist rather than another specialist. Karen's diagnosis: Karen is suffering from moderate somatic symptom disorder. She does meet two of the categories in the DSM 5 for moderate rather than mild or severe, with a comorbid diagnosis of unspecified depressive disorder and general anxiety disorder. Karen believes that her stomach pain is real and has been willing to sacrifice countless hours towards finding the cause. Karen demonstrates significant anxiety towards her classmates and has a fear that she will not be accepted among her peers. She uses her somatic illness as a defense mechanism to shield herself from scrutiny. She thinks that the pretty cheerleader girls just don't understand her and therefore must be judging her appearance and her illness. It's an example of both the level 1 defense mechanism, distortion, and the level 2 defense mechanisms, idealization towards the girls that don't have her problems, and most importantly, somatization. Obstacles to treatment. Karen's family is from a low socioeconomic status. Cost of treatment will be an issue. Karen has spent countless hours over the past years believing that her condition is medical in nature and is quite serious. It may be difficult to convince her otherwise. Karen and her therapist are different ages, genders, and ethnicities. While all of these factors can be overcome, it may be difficult to build rapport with Karen initially. Karen is a senior in high school, but is in danger of not graduating as her condition has prevented her from regular attendance and has impacted her studies. Rapid symptom reduction is paramount so that she can complete her studies in time, as this is her last semester in school. Prognosis and systems theory. Karen's prognosis is good, but of course, time is of the essence. As we stated before, we do need to reduce symptoms so that she can graduate on time. Cognitive behavioral therapy should be used in conjunction with SSRIs or other antidepressants. These are mostly to treat the comorbid symptoms of depression and anxiety, which overall should make cognitive behavioral therapy more effective and allow us to treat her somatic symptoms. Mindfulness exercises should be employed to help combat anxiety. And consider a family-centered approach, or family-centered systems approach, once comorbid systems of anxiety and depression are lessened. This should really help her to, get better in the long term. Other considerations. Therapists should be careful to examine the feminist context and other social pressures that have contributed to Karen's condition. For example, her admission that the pretty cheerleaders just don't really know what's going on with her. The etiology of Karen's condition may well have begun as a somatic defense mechanism resulting from her fear of being judged by the pretty cheerleaders. Since her symptoms began in adolescence, a number of immature defense mechanisms may be at play. CBT and mindfulness may help combat the defense mechanisms, and family systems may reduce recidivism as an adult. Therapists should rule out body dysmorphic disorder and use particular care when approaching Karen's cognitive distortions regarding her body image and socioeconomic status. A feministic lens should be applied to therapy to help Karen combat future distortions regarding her body image as it pertains to sexuality. And here's the treatment plan. So, for the initial phase goal, parents and therapists will collaborate on treatment goals and build rapport, modeling a trusting, healthy relationship as well as therapy expectations. As the therapist is not a teenage girl, it is going to be important to build rapport before anything can be done. Objectives. Client and parents will learn facts about somatic symptom disorder, and CBT will receive accurate information about recovery. Culturally significant issues will be addressed to help build rapport. Client will participate in Socratic questioning to begin symptom reduction. Therapists should keep a close eye on the effects of these symptoms. Is suicidal ideation on the table? So again, body dysmorphic disorder and suicidal ideation have to be ruled out. Otherwise, we have to change the diagnosis to one more severe. The working phase. The goals. The client should begin to identify connections between thoughts and somatic symptoms by identifying and challenging maladaptive thoughts and beliefs. Reduction of depression and anxiety through mindfulness, CBT, and medication. The objectives: client will develop balanced thinking and keep a thought record. Therapists will challenge distortions by asking client about automatic thoughts and breaking down defense mechanisms. And the final phase, the goals are to improve the client's belief over her stomach pains and reduce distorted thoughts. And also assess levels of depression and anxiety. Has a reduction in comorbid symptoms reduced somatic symptoms? The objectives: work within the family system to address possible recidivism. Go over with client what has been learned. How has her life changed now that she is no longer stressing over symptoms? Stimulate positive coping behaviors using behavioral activation in order to reduce likelihood of recidivism. Hopefully, once her life begins to improve, her somatic symptoms begin to decrease, and she will see a brighter outlook towards her future. All right, that's it. Thank you very much for the semester, Dr. Gonzalez, and thank you very much for the book that you gave me. I really appreciate both, and I can't wait to take more classes with you once this is over. I can't say how much I enjoyed it all. So thank you.